Hi, my name is Nicola Welford and I am from Tipperary. I live in Ballina-Killaloo in the Boher area on the Tipperary side of the bridge. So I'm a proud Tipperary woman. I'm a mum of 2 children. I have a son aged 12 and I have a daughter aged 9. My daughter is Julie and she so happens to have a disability. Julie is a full-time wheelchair user. She presents with quadriplegic cerebral palsy and she's non-verbal. However, we do not have a formal diagnosis like many families in this country. But we continue to live our lives as best we can and to embrace our community and to get involved in everything that we do within our community, with our friends, with our neighbours and with our school. Julie is a very happy girl. She has lots of friends and relatives that are living close by. Part of my journey as a mum of a child with a disability was starting to accept and understand what it was that we were being presented with. So initially in the early days, Julie was born as a perfect baby. We came home from the hospital as proud parents of a daughter to now accompany the son that we also had. Julie then started to progress and develop and get bigger, and we started to realise that she just wasn't meeting her milestones. So when Julie was 6 months old, I decided to get some help and advice and to see was there something else going on. So it took several months after that to discover that Julie did have a disability. And at that time, she was presenting with a physical disability. And we still did not know what was ahead of us. And I suppose in that moment, it was scary, it was daunting. The whole future was unknown to us and to Julie. And you're trying to get your head around things. So for a long time, we were on that journey of understanding, figuring things out, meeting different professionals, engaging with different therapists, to just help Julie continue to achieve her milestones, to ensure that she had good health and to encourage her to live a fruitful, healthy and happy life. So as time went on, with lots of intervention and with lots of support, we discovered that Julie was not going to walk. So Julie is a full-time wheelchair user and she now recently has achieved power chair skills. So she drives independently now at home, at school and out and about in her community. Part of our journey of understanding Julie and her condition and helping her to thrive and to fulfill everything that she wanted to achieve was also trying to make her fit in to her community, but also trying to get our community to understand that people with disabilities live everywhere and they belong everywhere. And we were finding that in particular, because of her being a wheelchair user, the environment was very inaccessible. So there's a lot of environments, public and private, that just don't think about people that are using a chair. As a result of this, Julie has a wonderful life. She has her coding club on a Monday night. She has her athletics club on a Saturday. She goes to mainstream school in her local primary school. She's very academic. She is learning the same curriculum as all her friends and she uses her eyes to communicate and she has an eye gaze device. Julie is fulfilling her life as best possible. We have had to work so hard to achieve this. In the early days, you are just exhausted. I suffered from sleep deprivation for the last 9 years. Things have started to improve in the last 2 years, but it is hard going. You need lots of help and lots of support around you, and it's not always there. And then emotionally, it can be very difficult too, because it's the not knowing in the early days. The not knowing if your child is going to walk and people not being able to tell you if they will or if they won't. The not knowing if your child is going to talk and people not being able to tell you if she's going to talk or not. But you must continue to work towards the goals and to help them as much as you can and to gather as much research and support as you can to help them achieve those goals. And then you might find in time that the goals just change slightly. And you start to accept that they have to change slightly and that your child is different, but you can embrace that difference and you can ensure that everybody else embraces it too.
How important was getting the support of your community?
So my biggest challenge in the early days to have her included socially and within her community was environmental change. And that's where I channeled, I suppose, my frustrations and my upset with trying to accept where we were at with Julie, but also not accepting where we were at either within our community and within our built environment. And I started to question things and I started to make contacts with people and I started to ask for change. And as a result, in the past 3 years in particular, We have worked very hard within our community to ensure that everyone is socially and environmentally included, whether they are a wheelchair user or whether they have another type of disability. And we set up a community group called Boher Community Development Group. So we managed to secure funding in excess of 500,000 to date. And we have delivered a fully accessible community sensory garden that is wheelchair accessible with 7 items of play equipment for sensory play. And this facility is open to the whole community and to all the children from surrounding areas. We've also recently delivered an all-weather pitch facility with an accessible walking path all the way around. And we also installed Rural Ireland's first ever Changing Places facility in our parish hall, which is now our community centre and a designated BCP in Tipperary. And in this parish hall, we have a state-of-the-art Changing Places facility for people with disabilities. We were trying to normalise disability because people with disabilities live everywhere. And now in our small rural community, they can come, they can play, they can participate, they can engage with our facilities, and they can be part of the community. And that, I suppose, has been the biggest journey for us. So as well as helping Julie as an individual and working with her on her own milestones, we've also worked within our community to make it accessible and inclusive to other children too.